think it's unique in that we fill the gap. I think we understand older people's needs. Volunteering, it's mutually rewarding, enriching in each other's lives.
I got a phone call from the RVS after I'd signed up, and they just said Alex had a fall, just come out of hospital, and was just needing, you know, a bit of general help, you know, while he's housebound. Yeah, it's very straightforward. It's the same as hanging out with anyone else. You just, you know, whatever's on your mind we can talk about, and if I can help out in any way, then it's fine. Alex knows he can phone someone if he needs a hand with something. Or...
Oh well, as far as I'm concerned, the voluntary service has been a huge help. A really huge help, yeah.
What we found in our experiences at the RVS Home from Hospital service has helped us initially in terms of supporting elderly people in their initial discharge from the hospital, but also more importantly and equally as importantly, sustaining elderly people once they have returned to their own home through providing the appropriate level of support over a number of days or weeks thereafter. These are absolutely critical. Without that intervention, without those things being in place, then often for an elderly individual it means that they cannot move home because there is not the level of confidence that they will have the appropriate level of food in the house, that the house will be warm, etc. So that they're absolutely essential.
I came into the home knowing that Sylvester would be on her own when she came home, as she lives here, and made sure that the heating was on for her and that all her essential foods were here so that we could settle her into the home and she'd have somebody to come home to. I think it's very, very important for people who live alone to have that one person even a week just to come in, just to be able to do things with and to take them out and do the hospital appointments, the hair appointments, anything they want to do that should give them independent living and also give them that confidence to do the independent living.
Social services are great, what they do. Likewise, you know, we've had paid carers at times. The difficulty with that is there's no continuity. It's often different people completely. So there is no continuity and you can't build up that relationship in the same way. I'm not saying anything against those services because they're in their own way they're fantastic, but this is because it's voluntary. It's just, you know, just completely better in every way, I think.
The Home from Hospital scheme really sort of fits in to people that have got sort of lower level needs that might not necessarily get picked up through sort of statutory health and social care services. So we see it really as a service that's almost a safety net for individuals. When somebody leaves hospital, it can be a really vulnerable time for them. They've had a lot of support around them, and then they're going home, and while their family might be there's so many people today whose extended family live a long way away. They work long hours, they can't necessarily always be there for them. So I think that we see the Home from Hospital scheme as fitting in alongside other services that we offer, and through the use of volunteers to really sort of help people to just get their confidence back after having been in hospital.